Hello, can everyone hear me? That sounds promising. Hi, I am Ben Williamson. I'm the Director of Outreach at Ambitious Impact, and I'm delighted to be here to introduce and MC these lightning talks from some of our newest charities. You'll be hearing from 5 of our founders today across a variety of cause areas and getting a very brief insight into the work that they do and why they particularly think that this is valuable. And we hope that these talks in part can give some insight into the broader scope of possible cause areas and intervention areas, and perhaps inspire you in your work, in your donations, to consider a broader range of possibilities of what it means to do the most good in the world. You'll have to listen to me for 2-3 minutes, and then I promise I will pass you over to our much more exciting organization founders. But I want to talk very briefly about this idea in terms of broader cause exploration. Quite simply, most interventions and causes have not been evaluated very rigorously. The space of potential interventions is just so much larger than the scope of organizations and people that we have evaluating possible options. And so, as you'll hear about from some of our organizations, some of the work that they do is not as well proven, but has exceptional potential. And we think that work like this is extremely important because there is so much that we can do in the world that is outside the scope of what has already been proven. The work of organizations like GiveWell is phenomenal, but we think there are more things that can be done. And one of the reasons that, like, for me personally, I think this is the case, is there is a somewhat suspicious convergence in some of the classic recommendations in the effective altruism space between what is most measurable and what we think of as highest impact. The fact that most of GiveWell or other kind of top recommenders, top organizations, tend to be on the more measurable side. They produce concrete outcomes that are relatively easy to measure, is something that we should be suspicious of, somewhat wary of. It is likely that the most impactful things that we can do in some do not happen to nearly all fall within the space of relatively measurable outcomes. At Ambitious Impact, in the way that we go about setting up new organizations, we try to think in bets, in the kind of positive expectation of what our organizations can produce. As much as I love all of our founders, we're not necessarily counting on all of them having phenomenal cost effectiveness, but we believe in all of them, and ultimately as a community, we are aiming at having the maximum amount of good. And that means taking bets on things that we have less certainty around, but could be exceptionally valuable. The top charities are still hard to beat, but we hope that some of the organizations that you might hear from today will in a few years be on this stage giving larger talks about how they're doing exactly that. This is a very terrible diagram that I made earlier this week that kind of illustrates this point. There is, in blue, the organizations that are recommended by top charity evaluators. So the very narrow kind of range of organizations that someone like GiveWell says, like, we're really excited about donations going to this space. The kind of dark blue is GiveWell or other organizations have looked at these organizations and think that they are less promising. And I think what's important to convey is that perhaps the majority of interventions or cause areas fall in this orange space, but we don't actually really have a very strong sense of how promising work is in this space. Perhaps in general we think work is less promising, but there might be specific interventions or specific approaches that might be particularly valuable. And part of the work of our organizations is, and the organizations that you'll be hearing from today, is exploring some of these more specific opportunities. Without further ado, I would like to move on to introducing our speakers so that you can hear from them. So we will have 5 talks today from each of these speakers across a range of different interventions and cause areas. Our first speaker is Klau Chmielowska, and I'd like to bring her up to the stage and let her speak for you.
Thank you so much. It's Klau Chmielowska, but I appreciate this. I know it's very hard. For all the Polish people in the audience, it is really hard. So great to have you all here. When I first heard about being invited to speak here, I was thinking what would be kind of the best angle to talk about. So I can talk to you about family planning, how cost-effective it is, but I think a slightly more interesting angle for all of you would be how to have your independent idea that you maybe researched, maybe you founded it, and how to bring it into a scalable organization. Because that's the question I receive a lot from basically from people. I get outreach to ask, I have an idea for a high impact charity. I already explored some cause areas. What do I do next? How do I get into CE? How do I actually build an organization from an idea? And I was in the same situation. It's a picture from a small young Klau 6 years ago in Nigeria, when I found out more about family planning and how impactful it is and how much promise it has as a cause area, as an intervention. And I really wanted to work on this. Although at the beginning, it's been very difficult because I was asking people questions like, hey, is this a good area to work on? Can we get any support? What's the next steps? And I was facing a lot of doubts and a lot of hesitations. So people were asking, wait, what if it's not cost effective? What if it doesn't work out? What if the government doesn't want to have you doing this work? And the best way for me to see how this idea can develop was to test it, right? So we ran the pilot. We ran pilot over the first 8 months. We bought 800 doses of contraception, thinking it's going to be okay for 8 months. It wasn't. In 2 months, we distributed all of it. The unmet demand was much higher than we anticipated because data was not up to date. The literature was not up to date. The gap was bigger than we thought. So here is a very small little chart that shows basically that how little distribution from the government was happening at the same time that our pilot was running. Even though we had very small funding, we already could see considerable results. But then there's, again, the next question. You have pilot, your project is working. What do you do next? So then it was time to commit and build the organization. It was actually during the EAX Singapore when I spoke to Fiona, I spoke to, from Suvita, I spoke to Patrick from New Incentives. And because of these conversations, I decided to commit and go full-time and work on Lafiya Nigeria full-time. Lafiya means health. Basically, we want to provide health to women in Nigeria. We want to provide universal access to reproductive health. And then the organization was born. We started working, and we built some more support, some next donations, more advisors. But then we had the potential risk of just staying in this position forever, of being a small-scale charity that is maybe doing some work, maybe not, honestly taking a lot of counterfactual funding and possibilities away from maximizing the potential impact. So the next point was to scale, get the momentum and grow. So for that reason, we decided to partner with a number of organizations, including Federal Ministry of Health or DPRISE. But the key aspect was actually being incubated by CE. So that's the conversation I had over this weekend a few times. We are CE incubated, but we already had an idea and pilot results before we approached CE. And AIM, sorry. And we basically went through this program, not only for funding, but more importantly, for learning the skills that we needed, for not building just from 0 to 1, but from going a 1 to 100, and to building a truly scalable organization. Here, this beautiful person on the slide is the co-executive director that I met during the AIM program, and she had the skills that I don't think I truly had in me of building this 1 to 100 organization. And that's what AIM did so well. It built the entire momentum to be able to go a step further. So that's where we are now. We currently work with 125 Lafiya sisters, which are healthcare workers in northern Nigeria. They provide contraception to women living in rural and hard-to-reach regions. And we've already provided contraception to over 25,000 women up to date. And our plan, thank you. Thank you so much. And our vision is very simple. You see this map? This is our trainings that's the first step of our program. We recruit those health workers, we train them in family planning, and they provide the counseling. And we work currently in those 4 states in northern Nigeria. But our plan for vision is very simple, to color this entire map. to make sure that every woman has access to family planning, because it's the first step for them to be able to have autonomy over their bodies, over their lives, and over their futures. And family planning is such a powerful intervention because of that. It's the first and fundamental step to be able to have all the other flow-through effects of income, education, of health for mothers, for children, and impact also on the communities. So that's why I'm motivated to work on this really hard. And I would also recommend, all of you, if you're thinking into having your own idea, what to do next, test it, research it, and see what's happening. The journey has been honestly difficult, but I never expected it to be easy. That's the whole point. It's gonna get even harder. So if you are hoping to hear about any of those topics, feel free to catch me on during office hours, and I'm very happy to talk about that. I just hope I can provide you a bit of an insight into how the story for Lafiya looked like. And everyone's story is going to be different, that you're going to be able to hear across multiple speakers. But this is one approach you have if you already have an idea you're interested in. Thank you so much.
Thank you so much. So our next speaker is José Mallén from Animal Ask. He is the Global Stakeholder Engagement Coordinator.
Okay. Thank you. Thank you to, first of all, Charity Entrepreneurship for giving me and the rest of the groups the opportunity to do this talk. And thanks to the EAG organizers for such a splendid event once again. And of course, thanks to all of you for coming to this talk. Okay, now, briefly, why are animals a good cause area to work on? Animals constitute the overwhelming majority of moral agents inhabiting the planet now and foreseeably in the future. The amount of suffering that human activity causes to animals, both directly as in food production and indirectly as in the use of pesticides in agriculture, is simply beyond our comprehension. The magnitude of the problem and the sheer level of neglect will continue to be prevalent in both near-term and long-term scales if we take a look at humanity's track record on this matter. So, let's talk about why research is so important in this area. I will now discuss two groups of major questions that exist. First, there is a need to respond very foundational questions. For example, one of them is, how do we compare welfare across different animal species? Groups like Rethink Priorities have done foundational work on this recently with their Moral Weight project sequence. Another question is, which are the most numerous groups of animals? There have been some big progress on this question, identifying groups like baitfish, shrimps, and other invertebrates, which now have dedicated charities and significant funding going into those areas. A third question could be, how should we think about the impacts of humanity on wild animal welfare? We have made very little progress on this as a society, but it could have serious implications for human health and well-being causes, as society's overconsumption of animal products is interconnected with a whole range of global issues with no evident solution in sight. Second group of questions are applied, concrete questions. The first question could be, what is the best intervention for a given country? This is our main work at Animal Ask. We partner with orgs so they don't just guess what the best intervention is, but have an evidence-based method for figuring out what the most impactful opportunities might be. Very high leverage way to empower existing organizations to have much more impact than they otherwise would. The second question is, what campaign opportunities or strategies are neglected in the movement? We've also done a bit of this, and I will talk about it shortly. And lastly, the third question is, what empirical studies are needed before we can even execute a particular intervention, and how could we conduct those studies? If you can identify these crucial considerations that keep coming up, then you can help unlock new impactful interventions that would not otherwise be possible. For example, the use of human pesticides is currently in this state of needing just a little bit more research. Okay, now, how to get started? One of the challenges with working in animal advocacy is that since the movement is advancing every year, no worries. One of the challenges, apart from these disruptions, with working in animal advocacy is that since the movement is advancing every year, it's not always easy to chart a path into a career. But here are some ways you can get started. The most visible route is to apply for jobs and volunteering positions. Animaladvocacycareers.org has a job board and a volunteering board, plus an online course where you can learn more about all this. They've also got a lot of in-depth skill profiles about ways you can help animals using various skill sets. A bit more edgy is to launch your own independent project. I think this is an underrated and easier to achieve than you might think. The best way is by applying to the Charity Entrepreneurship program. If you get into this program, Charity Entrepreneurship, now Ambitious Impact, will take you, train you, pair you with a high impact project and a co-founder, and usually set you up with a seed grant too. Outside of Charity Entrepreneurship, there are quite a few different ways to get funding to start your own project. Animal Advocacy Africa has a list with all the big funders around the world. Finally, I will briefly talk about the last 2 research reports we've published, which you can find on our website, animalask.org, to give you some example of the value that animal advocacy research can achieve. We recently published the framework we use to quantify the subjective experiences of animals. In essence, our framework allows us to systematically compare different campaign opportunities in how good they are for animals. And these comparisons can be made across different species, across different intensities of experience, for example, mild versus extreme suffering, and across both positive and negative experience. In our recent research, we scoped the US to find new opportunities for impact and found non-obvious states and animals as being really high impact. For example, bait fish, like you can see that, and also trout. We found the same situation. We found the same situation with trout in Idaho. We hardly think of Idaho as a global policy powerhouse in effective altruism, but in fact, if you're looking at improving fish welfare, Idaho looks like a surprisingly effective place to launch a lobbying campaign. I don't have the time to enter each of these reports, so I will finish here. Thank you so much.
Thank you. Our next speaker, Tom Norman, is the co-founder of FarmKind, a new effective giving organization set up in April 2024 out of the Charity Entrepreneurship Incubation Program.
Hi. Ben and George have talked about making bets and finding new opportunities and new things that we can do to make the world a better place. But all of this stuff needs money and needs funding. And in the animal space in particular, this is a big problem. we have between something like $220 million and $290 million, depending on who you ask, a year for funding the entire space. That means that if we gave 30 cents to every animal killed in America, we'd run out of money already. Huel has about $180 million in annual revenue at the moment. On growth rates, this year, they'll have more money than the entire animal movement, right? So this is a big problem, and we need to find ways to solve it. But it's also extremely difficult. We have a great effective giving community here. Lots of the organizations are around today. I was on an amazing retreat with many of them last week. But animal movements get around 10% of the money that they raise, right? Because when you're talking about to people about how to give effectively, GiveWell has these really compelling things. You can, save a child for something in the region of $5,000. These are things people can understand very easily. And then saying, oh, but actually, you should probably care about insects too and stuff. It's just, it's a hard sell, right? It's not so easy for people. So this is the problem that we at FarmKind are trying to solve. We are trying to find new donors for high-impact, effective animal charities, not taking money away from existing organizations and just moving things around, not taking money away from other parts of the EA ecosystem, but actually finding new people who we can encourage and bring in. So how are we going to find new charity donors? Well, as Ben mentioned, we just started, so I actually don't know. If anyone has any ideas, then yeah, just take me up later. But we have some theories about what we might be able to do. So I'm going to talk about 3 things. The first thing is how we talk to people. The second thing is how we raise money and how we can do that. And then the third thing is really what is our USP as a community, and how can we break through. So how do we talk to people? I think the fundamental first thing is we need to talk to people, not as spreadsheets. Most people in the world, even most people here, the thing that really gets us out of bed in the morning is not the ROI on our donations or something like this, right? It's the emotional part of what we do. We do what we do because we really, really care about people, about animals, about AI, some of you maybe. And we need to connect with that. Most people in the world care about stuff, and many people care about animals. The ASPCA has an annual revenue of something like $280 million, right? So already that would double the amount of money going to effective charities if that money moved to us. So these are people who already care about animals. They already care about the thing that we care about, but they're not donating to the things that can really make a difference. They're donating to mainly to the fundraising budget of ASPCA. Actually, it turns out. So we need to connect this thing, this emotion, with what we do. And that means speaking differently to the way that we normally speak, I think. It means thinking about telling stories, telling the positive parts of what we have to say, which is actually something we can do really well, right? Because we are making a difference in the world. So there's lots of good stories we can tell. So that's what we're really, really focused on, is reaching across the divide. The way that we're doing this is we're drawing heavily on the work of Giving Multiplier. This is a really cool way of raising funds, where you ask people, instead of telling them you're wrong for donating to your local shelter, we say, yeah, donate to your local shelter, but also you can help loads more animals if you donate, or additionally to THL or something like this. And so we ask people to choose their effective charity, choose a really effective charity, and split your donation between the two, and we'll match both sides. So we'll actively endorse your both speaking to your emotional needs and also your desire to do good in the world. There's some really exciting studies that show that this boosts donations to effective charities by something in the region of 73%, which is really, really exciting, just by doing donation splitting. Another 53% by doing the matching on top of this. So this could be really impactful in terms of bringing new people into the movement and new counterfactual fundraising. The final thing is, I think, talking about our USP. So when I talk to donors, and I've been doing some research, one-on-one interviews, talking to people, trying to find out what is it that gets ordinary people to donate and what do they care about. A big part of it is they want to know that their donation is actually doing some good in the world. Like, they donate to their local shelter because they can see the work that's done there. They can go, oh yeah, if I give them some money, then they'll buy them dog food, and little Rex will have something to eat, you know? And we can do that, we can answer that need, right? Because we can say, actually, look, we have really good evidence that if you give money, you will be able to help this many chickens to have a life that's not stuck in a cage the size of an iPad for their entire existence. We can move to plant-based meals so that fewer animals are dying and suffering. We can make it so that fish don't suffocate for their last 30 minutes of life. There are concrete things that we can say to people and do. And that's, I think, actually a really compelling message if we move it away from spreadsheets and towards connecting with those emotions. So that's what we're going to try and do. We'll let you know next year if it works. Hopefully, fingers crossed. But that's the mission. And yeah, I hope anyone here who wants to sort of find out more, please do get in touch.
Before I introduce our next speaker, a quick note to say we will hopefully have time for a few questions for a very brief Q&A at the end of this session. So you can submit questions through the Swapcard app, and I'll try and pick out a few of these if we have time at the end of our talks. Without further ado, our next speaker is Supriya Bansal, who runs ANSH, which was incubated in April of last year.
Hello, very nice to see you all. So I'll start with a story. Last month, exactly 1 month back, on 2nd of May, there was a baby born in one of our hospitals. The baby was 1,600 grams. To put things into perspective, that's very low birth weight. A normal weight baby is 2,500 grams. The baby was so small that the baby fulfilled the criteria for admission in a neonatal intensive care unit, or an NICU. But the hospital decided to discharge the baby instead. While our team at the hospital was trying to convince the doctors in the hospital to keep the baby in the NICU, the family left. For the next 10 hours, our team called the family for more than 7 times to get the baby back, to get the family to bring the baby back to the hospital. At 11:30 p.m., the family finally agreed to bring the baby back. When the family came, there was another struggle. We had to convince the hospital to admit the baby again. While we were trying to convince the hospital, the doctors realized something. The baby was in acute respiratory distress. To simply put it, the baby was dying. The baby was put on oxygen support within the next 15 minutes and stayed on oxygen support for 3 days. The baby is now home. He's 1 month old and he's thriving. But there was a highly likely chance that the baby would have passed away if the baby didn't come back to the hospital. Okay, well, I guess. Okay, great. Sorry about that. So what are we trying to do? Oh, no. We're trying to reduce neonatal deaths. A neonatal death is a death that happens within the first month of life. When you look at deaths happening in low-income countries, it's the cause of the highest number of deaths. When you move to lower middle-income countries like India, which is where we work, it's the 3rd leading cause of death. But when you move to upper middle-income countries or high-income countries, it disappears from the chart. This is a low and middle-income country problem, which means that out of 2.4 million newborns who died in 2022, 80% of them were preventable. And do we have a simple solution to prevent them? Yes, and it's called kangaroo care. It's nothing to do with kangaroos, no kangaroos in Australia, babies in India. That's what we do. It's a very simple method. It requires putting the baby on the chest of the mother or some other caregiver. And We also focus on exclusive breastfeeding, monitoring, but the main intervention here is putting the baby on the mother for as long as possible. Now, what's the impact potential? We have multiple RCTs that show that kangaroo mother care can reduce mortality by 33%. And that is in comparison of incubators or warmers. 70% of the babies that come into our program would have never received even the warmer care. So how do we do it? What we do is we find big district hospitals with really high mortality and high delivery load. Currently, we are in 2 hospitals, with one of them having more than 6,000 deliveries a year, and the other having more than 10,000 deliveries in a year. To put that into perspective, if our Pali hospital was in the US, it would be one of the 10 biggest hospitals in the US. And what is our implementation model? We partner with the hospital. We hire a team of around 12 to 14 people, most of them nurses. We provide them training in kangaroo mother care. We set up some KC required equipments like weighing machines, slings, things like that. We identify the most vulnerable babies, so low birth weight, premature, sick babies. And then we counsel mothers and monitor mothers while they do kangaroo care. We also conduct more than 4 follow-up calls till the baby turns 1 month old. Other than that, because we are already at the hospital in the systems, we try to influence systems to have better discharge policies, better infection prevention and control policies. We try to encourage them to reach out to their community health workers to check up on the baby once they go home. And in the last 5 months, since we started operating these hospitals, we have provided kangaroo care services to more than 900 babies, all of them low birth weight and premature. And we have referred more than 110 babies to emergency medical care. Now, all of this sounds like it must be very expensive, but in India, it's not. Currently, it costs us around $2,000 to save 1 life. That's our most conservative estimate. And this includes our core team cost and our M&E cost. We believe that per facility, we are at least saving 4 lives a month. Our future plans are to go into more hospitals and rapidly scale up these programs. Finally, we partner with a lot of organizations. We don't do this alone. We partner with EAG to build our kangaroo mother care applications. We are now funded by Founders Pledge, and obviously for AIM for taking this very risky bet of recommending an idea that was very direct implementation and required a lot of collaboration on ground. Thank you.
Thank you so much. So our final speaker will be JT Stanley from the policy organization Concentric Policies, incubated in the autumn of last year.
How are you guys doing, EAG London? Come on, let's hear it. So, in a moment, I'm going to ask you to guess what the annual burden of tobacco is. But first, here's some numbers for context. Malaria kills 600,000 people every year. Coincidentally, HIV, also 600,000. Now, I know some of you already know the answer, so if you do, don't play along for the next part. Raise your hand if you think tobacco kills at least 100,000 people every year. Keep it raised if you think 200,000, 400,000, 800,000. How about over 1 million? 2 million, 4 million. What if I told you tobacco killed 6 million people a year? And according to the WHO, we are on track to reach 8 million by 2030. Well, that would be true if this was 2011. We reached 8 million in 2019. It currently sits at 8.7 million deaths per year. Combine neonatal, tuberculosis, malaria. You're not even halfway to tobacco. So We know the problem is immense. And the issue is the funding and the number of implementers do not match the scale of the problem. We have two major funders in the space. They have their preferred focus countries, leaving most neglected. You have some countries that don't even have a local NGO that covers tobacco control. In the international NGO space, which is fairly consolidated, the actors that work on policy change have their active portfolios, which again leave many countries untouched. So I know at this point you're thinking, okay, but is it cost effective to secure policy change against a powerful industry? The short answer is yes. Let's look at the expected value. Let's look at tobacco taxation. The intervention that lends itself most to quantification, but is also the most effective. Tobacco has a price elasticity of negative 0.5. Now, what that means is, for a 10% increase in price, you have a 5% decrease in consumption. And it gets even better. Young people are disproportionately more price sensitive. And we know this because there is such a large, robust body of literature on it. In fact, the WHO and the NIH even authored a monograph on the economics of tobacco. So let's run a calculation here. Let's look at Nepal. Nepal is a high-burden country not covered by Bloomberg or Gates. It has the lowest taxation rate in the region. Let's say you take 27% effective tax rate on the retail value, and we move it to 41%. That would avert $590,000. Let's say I gave you a budget, $4 million to accomplish that, and we gave you 14% probability. Your expected value would still eclipse the GiveWell gold standard of $50 per dolly. Now, some of you are thinking, JT, you can massage the numbers in a CEA. You could get it to spit out whatever you want. This is not hypothetical. This was actually done. Let me introduce you to NDRI, a think tank from Nepal. They got external funding for 5 years to work on tobacco taxation. In 2 of those years, they got historic increases in the tobacco tax. Now, if you gave them $50 for every dolly that they averted, that'd be a budget of nearly $30 million. Needless to say, they did it in much less. So what does this look like for concentric policies? So we're currently working in Liberia to increase their tobacco tax. They have a 35% effective tax rate on retail. By the way, the WHO recommends that at a minimum, you do it 75%. And so what does that actually manifest as? Well, right here, you can actually see the excise stamp on that one. That's the cheapest cigarette pack you get in Liberia. This is 50 cents. You know what's cheaper? Or excuse me, do you know what's more expensive than that? Some basic necessities. Menstrual pads, $1. School children's notebook, 75 cents. This is why we're working with the Ministry of Finance to increase taxes on tobacco and alcohol. But we don't need to wait for policy change to save lives. We can cost effectively avert dollies just by enforcing the existing tax. When you pay the tobacco excise tax, you get a stamp. It signifies that your products are compliant, your business is in the good graces of the law. No stamp means no tax was paid, meaning you're liable. Product confiscation, fines, in other words, deterrence. Now, in 2022, the Liberian Revenue Authority collected only $158,000 in revenue on tobacco. There are 7.7 million packs of tobacco consumed by Liberians every year. That's at least $3 million. That disparity is what you get when you have weak enforcement, weak deterrence. What that is only enforcing on Thursdays, covering 300 to 400 businesses in the year. And this is in a country of a population of 5 million. This is a solvable problem, not to mention it's revenue generating so it can sustain itself. If you brought just 25% of the cigarette market into compliance, That would generate $800,000 in revenue. If fully passed on to the consumers, the cost, you would have 3,000 people quit, and that alone would avert $10,000. You could give us $500,000 and we'd be at GiveWell's benchmark. But we plan to do that for less. The bottleneck on us right now is the funding. And that means you can play a role in saving lives. I'm asking you to join us in combating the deadliest addiction on the planet. Please come talk to me and my wonderful co-founder, Sam, at the office hours. Give a big round of applause for Sam for being so patient with that clicker.
Could I get another round of applause for all of our 5 speakers? To take a few brief moments to wrap up some of the themes of today from our different speakers, I'd like to touch on a couple of ideas around taking action. We are very proud of our programs at Ambitious Impact, but sadly we cannot incubate organizations from every person in this room. And so I want to talk very briefly about evaluating and considering new cause areas for yourself, particularly in the kind of spirit of, say, with Lafiya, and going out there and actually starting an organization for yourself. And so these are a couple of kind of key ideas around what this might look like in terms of thinking about what you might work on. The kind of scale, neglectedness, and tractability framework in EA is very standard, but to kind of try and move a little bit beyond that, thinking more about the importance of an area in a broader sense. Some of the ideas that you can apply in thinking about what ideas you might be excited about or could work on include kind of the quality of the evidence, and also if the problem is increasing or decreasing in scope. As JT said, there's potentially particularly significant work to be done in tobacco because this is a problem that is getting worse, not better. And then for all of our charities, I think there is a case where they are taking a specific approach that is relatively, comparatively neglected to other approaches. So they might not be the only organization working in this space, but they are comparatively perhaps the only organization taking this specific approach, which looks particularly promising to the problem that they are trying to solve. In terms of thinking potentially about how you might take next steps on investigating an idea on yourself, I think a good place to start is just considering the existing evidence that is available. Are there RCTs or other academic studies available that suggest the effectiveness of an idea that you are interested in? Is there available evidence to say that this is a good idea, this is a bad idea, that we have a sense of how much impact a certain intervention might bring out? I think the other key idea here is having a very clear theory of change. This is quite a significant part of our incubation program that we impose on our incubated charities, is having a very clear sense, and this applies also for the kind of for-profit world, a very clear sense of what specifically you're offering and how that converts into impact in the world and what the steps are in between to make this happen. And if you're really excited about pursuing an idea, you've gone through some of these processes and you think, hey, actually maybe this idea that I have really has some promise, it's about thinking, hey, is there an MVP-like test, something small, something that you could do that gives you a next step sense of this really could work in practice? Is there a survey? Is there a very cheap test that you could do? Can you find one person or one place, one clinic where you can try and test this intervention and see if it works the way that you believe that it might? Of course, you can also apply to AIMS programs. And if you do that, our next application round opens on 22nd of July. We make this process a lot easier for you. We provide research-backed ideas. There's hundreds of hours of research that goes into the ideas that we recommend to our program, and everyone that comes through our program is provided with these ideas to select between to found their charity. We'll also pay you for 2 months, and we'll connect you to seed funding, and we will connect you to a co-founder. Applications are not open right now, but I would encourage you to sign up to our newsletter to stay up to date with our charities and our programs, and also be notified when our next programs open. If you go on our website as well, there's also a quiz for which the QR code is here that you can take to see how your skills and your interests might fit between our different programs. Charity Entrepreneurship is the program that incubated all 5 of these charities, but AIM is expanding. We are launching a for-profit program for the first time early next year, and also have a research training program. So if either of these sound of interest to you, I would encourage you to take a look. Lastly, I want to make sure that everyone is aware we have office hours for our speakers following this in the Docklands room, and I would greatly encourage you to go along to these and ask any questions that you have to our speakers during this session. I think we have a few minutes spare, so I am going to take a look at Swapcard and see what questions that we might have for our incubated organizations. So the first question is for Lafiya. There are many organizations doing family planning and contraceptive distribution work. What makes Lafiya different?
Thank you. So there are two things that I would say make Lafiya different. The one is the focus on Cyanapres. Cyanapres is self-injectable contraception that costs only 85 cents and provides contraceptive coverage for 3 months. It's ridiculously cost-effective, basically, to provide contraceptive access with Cyanapres specifically. The second thing is the way we distribute contraception. We use community-based networks of local nurses, midwives, and community health workers. And that provides not only for like a trust-based distribution, but also we are leveraging underutilized like human resources, being able to already be in those communities where the unmet demand is the highest. So those two things I would say.
Fantastic, thank you. And JT, a question for concentric policies. Do you believe that a full ban on tobacco could be effective? And if this is a viable option or something that you guys have a strong opinion on?
So I assume this is referring to the smoke-free generation, which New Zealand was going to do until the change of government, and here the Prime Minister, Rishi Sunak, has advocated for. I'll flag up front, me and my co-founder have different viewpoints on this. I'll say in my personal opinion, I think it is possible. I think in some ways it's a bit of a crude instrument. You definitely justify it from a utilitarian perspective. But I think the important thing to take away, regardless of whether you're looking for a solution like that or not, is the industry is the vector. We've had tobacco for centuries, millennia. You did not have the modern tobacco epidemic until you had the heavy engineering of cigarettes to be palatable and addictive and the mass manufacturing of them. So to really bring the tobacco epidemic to an end, you have to go beyond what the WHO is asking, which Turkey is completely compliant on. They still have a huge tobacco epidemic. And you need to look at, okay, what more can we do? And it goes back to, I think, treating the industry as a vector. Whether or not you want to do the smoke-free generation, that's a debate we can have. But yeah, that would be my take on it.
Perfect. And then another question here, perhaps well suited to you, Supriya. Some of these initiatives can be replicated by governments at scale. Is becoming redundant in this way, perhaps a strong word for this, but is government adoption considered success for you?
Yeah, I mean, government adoption is really the ideal way to sort of end this. I think quality would be an issue, as we see with the hospitals and how not efficiently the hospitals are running. I think that would be the biggest concern. And if we can provide heavy monitoring and quality assurance with the government implementing it, that probably would be the most idealistic scenario.
Wonderful. And I think perhaps time for one final question. I'll open this up to anyone. How do you compare your interventions to structural or governance changes that potentially might be more cost effective in the long term? Do you feel like your work risks taking away funding from these areas?
This is easy for us because we're trying to increase the funding. But I think that in the animal space in particular, we actually it's really important to have all these different things. And I think one thing that's really key is that the way that we assess cost effectiveness in the animal space is very focused often on how many animals can we help with these dollars, and actually sometimes isn't as focused on these kind of policy levers, particularly when you look at the ways that for example, ACE evaluates charities. And so actually I think one of the things that we're really excited about is more viewpoint diversity within the animal funding space in general. And that's so more money and more viewpoint diversity about what the kind of levers are and how to be effective, because we think there are lots of kind of ways to approach this, and they're all kind of complementary to one another, and that's a very important part of the sort of overall long-term theory of change here.
Fantastic. I think that is us out of time. So yes, a final round of applause for our speakers.